I'm Kyra Min, WUVA. To see what it takes to keep the Cavaliers on the field, I interviewed two of UVA's orthopedic doctors about their role with UVA football. In my interviews with Dr. Gwathmey and Brockmeier, we discussed injuries associated with football.
Collision-based injuries are probably most common. So you're going to see injuries to the shoulder. The most common thing we see is instability of the shoulder. And then it's also a sport that involves a lot of, kind of high explosiveness running and burst type things. And so you'll see kind of the typical muscle injuries associated with that.
The most common injury we see in football, obviously you're going to have head injuries, concussions, and things. We really worry about that a lot. The scary one you hear about is the ACL tear. That's the one that an athlete will be out for the season with.
I would tell you, for my job, probably the most challenging injury is one where you need to evaluate and rule in or rule out a significant structural injury to a joint to determine whether that individual can go back into the game and play during that game or not. It's much easier if you have time. You can let things kind of sort out. You can image. You can do a more kind of detail-oriented evaluation of somebody. But in real time, if our starting quarterback goes down and comes out, and you look at him, the judgment you have to make is this okay or is it not okay? And that's really kind of almost the essence of sports medicine.
How can some of these injuries be avoided in terms of like practicing before games and things like that?
You can actually visibly see a lot of the changes, not just from the standpoint of how the kind of the rules are for the game and how the game's played. Because if you watch football back in the 80s, a lot more intensity as far as the hitting, a lot less in the way of kind of player protection. But from the standpoint of sports medicine and sports science and understanding how to manage these injuries and how to prevent these injuries, it's come a very long way. Practice is important, but sometimes you can over-practice and exposes the players to an increased injury risk.
Hard to prevent all injuries. Obviously we incorporate proper training methods. The big thing for strains is maintaining flexibility, pliability, working out in the weight room properly.
I continue to be amazed at kind of the level of strength and the level of capacity of some of the athletes that we take care of. They're different than the typical person. They recover differently, and quite honestly, they can kind of compensate to a large degree to injuries that maybe you and certainly I would not be able to compensate for.